public to participate, so please keep that in mind as you comment. I will ask that you keep your microphones on mute when you're not speaking. You can use the chat function through Zoom if you need to make a comment about a technical or logistical issue. We have Jeremy from MAG here to help monitor that and offer any technical support. Please know that the chat will also be recorded and a part of the public record. For the purpose of meeting minutes, I ask that you state your name before any comments so that we have your comments on the record. And finally, for action items, we will be taking roll call vote. So I'll call out your names in alphabetical order and then ask you how you vote. Let's move on to the introduction. I'll call each member's name. This will be practice for you to see where you fall in the order, and ask that you introduce yourself and your organization. And I'll start with my vice chair, Jacqueline Edwards.
Hello, everyone. As Christina said, I'm Jacqueline Edwards from the Maricopa County Human Services Department.
Thank you. Melanie Dykstra.
Melanie Dykstra, Town of Gilbert Community Resources.
Hi, Melanie. Naomi Farrell.
Naomi Farrell, City of Tempe, Human Services.
Awesome. Autumn Grooms. Laura Guild, I think, is joining us later. Susan Hallett. Mary Lynn Kasanick. Is it Kasanick?
Yeah, Kasanick, Area Agency on Aging.
Great. Chris Lopez, are you here for Chris, Edith?
I am. Edith Galtier is with us in Avondale.
Good to have you. Jason Matthews.
Jason Matthews with the Valley Sun United Way.
Debbie Pearson.
Hello, everybody. Debbie Pearson with the City of Peoria.
Leah Powell.
Leah Powell, Chandler Neighborhood Resources Director.
And Cindy Severino. And now I'll ask staff to introduce themselves. Brandy.
Hi, thank you. Brandy Mead, MAG Human Services Director.
And Tina.
Hi, this is Tina. I'm the Administrative Assistant for the Human Services Division.
Thank you. We will move on to the call to the audience. Please note that members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov/comment within 1 hour of the posted start time of the meeting. Brandy, has staff received any comments from the public?
No, we have not. Thank you.
Okay. Then I will request a motion to approve the meeting minutes from our October 8th meeting.
This is Jacqueline Edwards. I motion to approve the meeting minutes.
Awesome. There's
this is Jason. I second.
Thank you. So all in favor, Melanie?
Aye.
Jacqueline? Oh, you made the motion. Naomi? It's not here. Autumn? Also not here. Laura's not here. Susan's not here. Mary Lynn?
Aye.
Edith?
Aye.
Jason?
Aye.
Debbie?
Aye.
Leah?
Aye.
Cindy? Oh, she's not here either. Okay. Moving on to item 4, the SSBG funding recommendation process. Brandy, will you begin the discussion, please?
Sure. Thank you, Madam Chair, members of the committee, and want to start by thanking you all for making time to be here today. I know this was an extra meeting that was scheduled so that we could talk about the SSBG funding allocation recommendation process. So appreciate all of you for being here. Just wanted to start with just a brief overview and then really want to jump into your recommendations around the process that we want to decide on for moving through these funding recommendations this year. So we are going to be recommending fiscal year 2022 SSBG funding to DES, or the state, and that will be for the Maricopa County region. We have a projected funding level of $3,615,416, which is a continuation of the dollar amount that was funded last year. So once we have a federal budget, there may be some slight increase or decrease to that, but right now we're planning for a continuation of last year's amount. So it's roughly 3.6 million. We'll move that through the MAG process, and then those funding recommendations go to DES, which then goes into their state plan. There are 4 different service areas that our funding allocations fall in. We have the service areas of adults, family, and children, developmental disabilities, elderly, and then persons with disabilities. And I'm going to go ahead and share my screen. I have a couple of documents, materials that were sent out prior to the meeting that I thought would be helpful to look at as we discuss this process. But before I pull up those materials, wanted to just summarize. So for our timeline, we do need to have recommendations that go through the MAG process in January. So we have between now and beginning of January to develop those recommendations. So we can talk about some different options for getting to those recommendations. And I'm going to go ahead and share my screen and pull up a spreadsheet. Give me just a moment. Okay, it's coming up. Just one moment. Okay. So what I'm showing, can everybody see? There should be an Excel spreadsheet on my screen. Okay, I'm seeing thumbs up. So what you should be seeing, and let me minimize this. This spreadsheet was sent out in advance of the meeting, and it's a 6-year look back of our funding recommendations over the past 6 years. And you can see that these recommendations are broken up into the target groups: adults, family, children, developmental disabilities, elderly, and persons with disabilities, and how we allocated the funding in the past. So in summary, 4 years ago, what we did was we decided to reallocate. You'll see this column for developmental disabilities. We had decided to reallocate funding from this entire target area and put those dollars, we split evenly into the other categories. So you'll see in green, each of these different columns represent an increase to the different service areas as we reallocated funding from developmental disabilities. And the reason we did that was because we received information from DES that there was other funding that could support that target area. So the decision was made by the committee to reallocate those dollars. So that's why you see, going back over the past 4 years, there's nothing allocated in those target areas. And then last year, there was a slight increase in the SSBG funding of over $41,000. And so that increase went to one service area, and my screen looks like it's frozen, so I can't show you. Oh, there we go. So it was you'll see highlighted here, $439,000 for the target area of elderly, and that went to home care. So providing in-home care. And the reason we decided to allocate all of that increase to that area was because of the need that was expressed for that area to provide home care for elderly individuals across the region. So there was a slight increase in that area, and then the other dollar amounts from the previous year to last year remained the same. So this funding chart indicates how those dollars were allocated for the past 6 years. It includes the target areas, and then on the right-hand side, there's a description of each of the service areas. So if you scroll over, you can see a description of each of the service areas. So this year, we do need to develop our funding recommendations, and there are a few different options. So I think what I'll do today is talk about a few options and then get your feedback about where you would like to go this year. The goal for today is to come up with the process that you want to move through to develop these funding recommendations. So before moving on to the options, are there any questions about how dollars were allocated in the past, or about the spreadsheet that was sent out? This should look familiar to you. I know you've looked at it each year. Okay, I'm not hearing any questions. So in terms of options, so again, these are just me coming up with some options based on previous actions. So option A would be, if the need is unchanged, is to forward the allocation recommendations as we did last year. So to not change anything, assuming that we have the same dollar amount to recommend, we just proceed with the same recommendation as last year. Option B would be to follow a process where we invite experts on the different service areas to come and present to the group. And we would ask them to present on the needs and the gaps in the community for each of the different service areas, and their recommendations for how we allocate these dollars. And then we would determine how we want to proceed based on that expert input. Option C would be to complete a survey or a ranking exercise where we would ask members of the committee to rank your priorities around target areas or service areas. And then we would base the recommendations on the priorities from the group. Another option would be to follow a service ranking exercise or survey and send that out to members of the community and ask the community to provide input to this group on how they feel the dollars should be allocated. So this is something that we've done in the past. About 6 years ago, we did a service ranking exercise where we did get input from the community in terms of a survey, and on a scale of 1 to 5 for each of the different categories, how the community thought the dollars should be allocated. So that is another option that we could undertake. And then another option would be, a hybrid of those different options, or, something completely different that the committee would like to recommend. So I'll open it up to the committee to get your thoughts on those different options, or if there's something else that you would like to see considered.
Hi, Brandy. This is Naomi. I have a question for you on the option where you are proposing a community survey. When you say community, are you talking about a survey to providers or those that are participants in the programs and services?
So it would be what I was mentioning was to providers. And that is something that was done in the past. It's been many years since we did that process, but that is something that we've done in the past. So we sent out, and I can show you an example of that if you're interested in seeing what that looks like.
Oh, yeah, that's okay. Thank you.
Okay.
Is there someone who was here back when the decision was made to move away from that who might be able to provide some insight as to why that decision was made?
Christina, I can jump in and just say that I know some of the feedback that I recall is that it was difficult getting people to respond to those surveys. We sent the surveys out and did not get very many responses. And so it was a lot of effort without a lot of results.
This is Jacqueline, and Brandy, if I'm recalling correctly, when we did that, it also became kind of lopsided because we would get a lot of response just in one area. So it really wasn't giving us the whole view of what was going on in all of the different systems that would be funded. So I think as much as it's, want to hear the feedback from the organizations, I don't know that I don't know that it's actually effective. Now, if we had the list of those who are funded, like from DES, and we're able to target them, then I think that would actually be beneficial, rather than just pushing it out to a whole, like network of agencies that may not, have different levels of understanding about funding and whatnot.
This is Melanie. With that in mind, are there agencies like DES does not fund that? I don't know how it works with DES. Do or agencies apply for supportive funding, or are they choosing?
No, they're already this is Jacqueline. They're already providers. And so they are, in each of these categories, the funds are directed to specific agencies. So
how did the agencies get selected by DES?
Yeah, it's selected by DES.
So when DES is selecting them, is their process of selection, how do they do that? Is it an application process?
It's not, well, not for all of these, but for a lot of these, it's not a competitive process. I'm not in like DD, I'm not, that's a whole world in of itself that I'm not all entirely familiar with. But I know that agencies have to meet a set requirements to become, to receive funding and reimbursements from DES. But in the other ones, there are agencies that, most likely have had long contracts, withstanding from DES.
So I like the idea of, if we were going to survey that way and get some information, a very short, simple, no more maybe than 5 question about, and to those providers. I think that would be, something I have never been a part of. It'd be interesting to see that information. I feel like that could give some insight into where the need might be, if different than what it is now.
And we did receive some of that information from DES in terms of the nonprofit providers that do receive these funds. It was a fairly complete list. I think there were some categories that we were still waiting to hear back from DES on in terms of who's receiving those dollars. But I can follow up with Rodney to see if we could get that complete list of nonprofit providers receiving these funds so that we could survey them, if that's the direction that the group decides to go in.
This is Jason. Just to chime in, I also like the idea of the survey and just kind of following. Again, if it's possible to get that kind of feedback, I think that it could benefit the process.
What do others think about doing a survey this year? Is there agreement on the survey? If there is agreement to move forward with a survey, then I would like to get your input on questions that we would like to include on that survey so that we can get it out quickly.
This is Leah. I do think a survey is good, and I do think that we need to include a question about how COVID has impacted their business, the way that they're able to serve, or also an increase in demand or a decrease in demand due to COVID. But also along those lines, have they been able to take advantage of any special funding due to COVID?
Yeah, I was having the same thought in terms of just curious how many people might have some pools of resources that they cannot get out fast enough that are gonna be available into the next year.
This is Naomi. I would agree with both those comments. We have surveyed some of our nonprofit providers too and asked them some of our questions, and it was very helpful in determining what some of the needs were and what has changed.
So this is Mary Lynn. You know, the needs of the elderly have just grown exponentially because of social distancing, you know, stay at home, not being able to go grocery shopping and so forth. But the concern is when the federal COVID funding is over, it's going to be a huge drop in funding, I think, to all agencies and cities and towns and so forth. Because we know that, you know, almost every agency and every government has received huge sums of money to respond to COVID. So if you've increased your client caseload or your client number of clients you're serving, what will happen when, quote, the COVID money dries up?
So Mary Lynn, is that what you're saying, is maybe adding that in, you know, like that as a type of question, as to, you know, how do you anticipate, you know, your funding impacts when, you know, that source of funding is not available?
Yeah, I mean, I think it could be a two-part, like, or, you know, little, you know, how is COVID impact the demand for services? Have you, you know, received additional federal funds, probably, most likely, or received additional funds to respond to that? And what will happen to that client base when those funds are no longer available?
But I think it's also, sorry, go ahead.
Oh, thanks, Christina. So I agree with you, Mary Lynn, about, you know, what happens after the COVID funding goes away. One thing, though, that's important, you know, with respect to COVID, so if they've created new programming, and I bring this up because just looking at, you know, the nonprofit side of things, you know, the county did, you know, both small business, but a whole nonprofit grant process. And so we saw a lot of these kinds of applications from these types of agencies. And many of them were asking, you know, for funding for new projects. And, you know, I think by asking questions to make sure that, are we just trying to provide the same level of service, or are they going to use additional funding for expansion or continuation, or, you know, brand new types of, you know, services or service delivery methods in each of these areas?
So if I can respond to that in terms of aging services, almost all the senior centers have gotten challenged by the request for meals, home delivered meals, because seniors are afraid to go to the grocery store, and when they do, the shelves are empty and so on and so forth. And I know that our senior centers have added, let me look real fast, have added at least 2,000 more clients to the number of people that they're serving. And so our funding, our COVID funding is going to support those senior centers as they attempt to serve more people and a demand for services.
Yeah, and to that point too, Mary Lynn, this is Jacqueline, both the county and the city of Phoenix, and I'm not sure about the other cities and towns, but pushed out funds through the Arizona Food Bank Network, a significant amount of funds to go to the major food banks and their partners. And, I think, again, us really being targeted at those questions to see, how much funding they have, what it's being used for, how this funding will, how they're planning on using it, combining all of these things. I think it's going to be really important for us to get the full picture.
And if I could add, Mary Lynn, you're a tremendous advocate for the senior population. I also think that families that are experiencing difficulty with their rent, mortgage, and on the brink of homelessness have had, from what I understand, and the people in the virtual room have a lot more direct experience than me, so I'd be interested to hear what your all's take is. But my understanding is there's been a tremendous blessing of influx of coronavirus relief fund, CARES Act funds to help with rental and mortgage assistance that's going to not be available anymore, and that the traditional funding sources for that are traditionally underfunded in terms of the need. And so I was just thinking that it'd be important to hear, like, they may have got an influx that has helped them serve more people, but is what they're generally funded also inadequate to carry them through after this?
Yeah, I think it's a good point.
And it's certainly going to affect those agencies in the children and families category. Without Congress doing anything, the utility and rental assistance funding that the city of Phoenix and the county and Mesa and other communities have been able to push out, goes away December 30th. And what I can tell you from the DES funding side, the typical utility and rental assistance funds, both COVID and the regular funding sources, although they increased, most of that money has actually already been expended. And so it's, we're even evaluating how much funding will be left in the next, for the second half of the fiscal year from January through June. So these funds go into providing those services currently, through the community action programs.
This is Leah, and along those lines too, what we've heard from our CAP office is there are a lot of families out there that don't qualify for the COVID funding.
Right.
But unfortunately, there's a lot of, I think, confusion. And so families heard, moratorium on rent, and they just stopped paying their rent. But yet they may not qualify for the true moratorium, and they may not qualify for the COVID funding. So I think we probably will be seeing some kind of a snowball effect come the first of the year or so. So it'd be good to hear from them on that perspective as well.
And to chime in on that, this is Melanie with Gilbert. That's what some of our nonprofit providers saying the same thing in terms of a lot of this money has all been focused towards the COVID response. And the concern is that some people's situation just has not literally changed from the fact that they just struggle in general with needs that are ongoing, and without base funding, that it's hard when everything shifts to the one thing where they're really trying to figure out how to still financially support, some of the needs that are out there that are not related to COVID. You have, again, seniors fixed incomes, you've got folks who are disabled, and COVID's not really in play with some of the needs that they actually have. So we go back to just the need for just base funding for services.
Another thing that I'd be interested in hearing from you all on is domestic violence, because according to our police department, those calls had increased, not necessarily even spousal related as much as, just the tension among roommate situations even.
I've heard that as well, Christina, and I've also heard from shelter providers too that there's a reluctance to go to shelter because, fear of contracting the virus.
And then the other thing, our Faith and Community Roundtable recently had a discussion about people going, it came up from the group about people who were on medication for mental health and electing to go off of their medication for whatever reason, and then aggravated by the fact that COVID is keeping people at home. So they're not on their medication and they're stuck at home with family caregivers. Is anyone else hearing anything about that? No.
This is Jason. Christina, I have heard those, and I mean, and to kind of respond to you first, we have been hearing an uptick on more cases of domestic violence just happening across the county. And again, unfortunately, that's just connected usually to the economic recessions and any kind of like high stressful events such as this one. And then you add the COVID pandemic on top of that, which again, now you're, people unfortunately are in a space of self-medicating and they're stuck at home, which unfortunately creates a kind of a bad or a hard situation. And Brandy, to your point, we've also heard, some of those folks that are reluctant to go to shelters just because of looking at some of those services that were already there, but now you have a public health issue that's on top of that. And then furthermore, as far as like the continued duress of mental health, and again, all the things we just talked about, as well as, folks that may or may not have access to, whether the medications they need or to some of the care that is needed as well. And while there's been some great advancements in mental health, like telehealth and those kinds of tools, the demand has also been higher as well. And so there's some short gaps and some shortfalls that are there. So I kind of look at it to where like, and again, we've probably all been saying this, but all the needs that were there before the pandemic were there already there, and then they just got worse. And then you just added more people on top of that, with a whole other set of needs that I think unfortunately have been compounding upon each other. And that series of compoundment has led to even a higher level of stress across the board that has just exacerbated many of these issues. And then you add, rental moratoriums and utility assistance moratoriums and the potential for bankruptcy and legal assistance and all of these other things that are just out there. It's a hard time. So,
yeah.
And so I think that, operating within this historic space, I think is just going to be a challenge for all of us. So anything we can do, I think is going to be helpful. And if there is a space to get some kind of feedback, where they can most need those funds in order to do services. And I'll add one more thing that we're hearing about, and then I'll shut up, is that we're also hearing a lot about the strain just on the nonprofit sector, and that nonprofits are just struggling to get the doors open. And so, I mean, they're just, they're paying for rent in spaces that they haven't been using for 8 months, for example, but they can't get out of a lease. And it's just a difficult time. So
Yeah, I heard that from the nonprofits also. A lot of their grants did require dosage. Like if they cannot be having the interactions with their clients because of COVID, then they cannot be drawing down the funds from their grants even. So it's a real, a lot of, that's why, back to, I guess, Mary Lynn's point, and I don't know, maybe this is the way even that you meant it, but this is a real opportunity for requiring people being organizations in this case, to pivot in terms of their service delivery. And with or without COVID, there's going to be things that need to be sustained through this, because they've been able to help people and increase the number that they've been able to serve with these resources and adapting, but now they may need to sustain that adapted mode, and it may call for cutting down on traditional or abandoning some of the traditional methods. So the fact that they've increased the number of people they're serving, they may be being able to do it more efficiently. And if that's the case, that's something I hope that they'll be transparent about in a survey about needed resources.
Yeah, the other thing is, we're talking about the clients, but I think it was Jason who brought up about organizations. The other problem is most of us have gone to working from home, and that has been a tremendous financial drain on buying everybody laptops and printers for their home, and maybe getting them cell phones because they don't have a desk phone to call clients. And so I think there are many nonprofits that suffer from that additional. I mean, yeah, they don't need the space, but as Jason was saying, they still have to pay the rent on that space because they have leases. And at the same time, they had to outlay a lot of money to adapt employees to work from home.
Yeah. So do we hear consensus around the survey of recipients, and maybe the survey looks sort of like a rank choice of the eligible categories with some open-ended questions about their current COVID, the impact of COVID, and their current, how their financial portfolio was impacted by COVID resources?
I certainly agree, and I think that maybe to add a little detail, if you're open to a friendly amendment to your motion that you didn't make, but
I think you have to make the motion. I don't think I'm allowed to make motions.
Very true. But I think that one kind of like question would be, that question on financial position would be not only the new revenue opportunities that they may have seen from COVID, which I think we discussed, but also some of their potential additional costs associated, whether that's digital divide or just PPEs. I mean, I know a lot of childcare centers all of a sudden have they're already kind of investing a lot in, some hand sanitizer just because of kids, but at the same time, it's a lot more. So anyways, but yeah.
I agree with you, Jason. There's not only is it the computer stuff, but the PPEs, the face mask, and in order for ombudsmen to go into nursing homes, we had to buy them disposable gowns and disposable gloves and face shields and that kind of stuff. So, and as we know, I think they're more affordable now, but there was a time when the sellers were really taking advantage of us. There were some, crazy amounts of money that they charge for the PPE.
If we're going to ask about revenue and expenditures, then we need to do a comparison for context. So, what was your funding during a certain time period, last year compared to this year? And then that will help, show the difference, other than them just saying like, oh, I have more expenses. Just seeing a number won't really tell us.
That's a good point. And I see that Melanie has her hand raised, so I want to make sure we get to Melanie, but just wanted to just state that when we make our funding allocation recommendations, we recommend in a category. We don't necessarily allocate funding directly to each nonprofit provider. So we'll just have to keep that in mind as we get the survey responses back. And I'll draft a survey and send it out to everyone, but we'll have to ask the respondents to indicate which funding category they receive from DES, so that when we get their responses, we can tie them back to how we make our allocations.
Great.
Melanie, do you have a question or a comment?
I just wanted to clarify. I think Christina, you said we would ask some of the specific survey questions. Did you also say that you wanted the providers to also rank order the priorities, like within their category overall?
I was tossing that out there. It seems easy is to like ask them what pot they're getting money from, and then if they were king of the world and they got to make the distributions, because they're the ones who are going to be constrained by our decision. So what constraints would they put on themselves if they were to do that? Maybe that's naive, but I don't know.
I guess if they're trying to do all the categories, I mean, sometimes obviously you're kind of in your own space, and I guess I'm not sure they would know what to do with it. I feel like maybe if we're asking them to do, maybe if it's within like all of their area, it'd be one thing.
Oh, only for their area.
Okay,
yeah.
because I'm like,
yeah.
I don't think they can do the rest, because I don't know that they would feel comfortable. Okay,
take all the money from those other people and give all of it to me. No, that's honestly, that's what happened. I was there when we made the decision to go away from surveying the general public, but I didn't want to be the first person to say what I observed was that the people who had the most engaged recipients were the most likely to respond to the survey. It was not, yeah. So is there a motion? Oh, somebody was going to say something?
Yes, yes, we'll need a motion and to take action on this item. But it seems like we're going in the direction of a survey, so I would just offer to create a draft survey based on the information that was discussed today. I can send that out to this group and get your feedback, and we can do that over email, and then finalize the survey and get that out quickly. We have our next meeting planned December 10th. So we would need to get the survey responses back very quick so that we can summarize those results, and I can present the results to this group at our December 10th meeting. So then if that's the direction this group wants to go in, then we will need a recommendation to take action on this.
So given the holiday, Brandy, do you think you have time to get a draft of the survey together this week?
Yes, absolutely.
Okay.
Great. Okay, I'll make a motion. This is Jacqueline. Make a motion for a community survey to be directed to those recipients, past recipients of the SSBG funds from DES, and direct staff, Brandy, to create a survey to be issued to those providers prior to the end of November.
And I'll second that.
Great.
Mary Lynn.
Thank you. All right, so we'll do a roll call. Melanie.
Aye.
Naomi.
Aye.
Edith.
Aye.
Jason,
Aye.
Debbie,
Aye.
Leah.
Aye.
Did I miss anybody?
Mary Lynn?
Oh, I thought you seconded it.
Okay, all right, thanks.
Okay. So it passes, right? Awesome. Thank you, everyone. That's some good innovation for us too. It'll be interesting to see how this works out in terms of supporting us in this effort, and if it's something we wind up keeping in place even post-COVID. So cool. Thanks. We'll move on then to the lightning round. This is an opportunity for you all to report out on any local or national best practices, things you're proud of in your organization, struggles or challenges you're having, opportunities that we can support you. And I would like to go ahead and start with Melanie if you're ready to share anything.
Sure, if I have anything to share. I think we're just kind of gearing up for our next round of our putting out our CDBG CV3 funds here and focusing on kind of delaying that just a little bit in order to give organizations an opportunity and chance to see how their funding, is working out and what the need's really going to be. So I think that's where I'm kind of waiting just to hopefully give them a little more time to use the funds as well, because we know everything went really fast to start with. So that's something we're focused on here. Other than that, definitely staying busy when we did allocate out $2 million of Arizona Cares funding to a whole slew of new nonprofits we haven't really worked with as well. So I have probably 30 contracts that I now am overseeing with nonprofits. So been busy.
No kidding. Congratulations to you. That's a lot of good work.
Yeah, we are excited that council was able to, we were very fortunate. We had started some nonprofit town halls right at the beginning of the pandemic, kept that going through the summer. We did a survey right at the beginning and ironically had just done another survey to all the nonprofits serving our residents to see where they were at. And I was actually able to present that data to council when it came up that these Arizona Cares funds might become available. And with that, they highlighted and saw the need and took $2 million to allocate back out where we were able to do that. So
that's exciting.
Yeah, so that was good.
Cool. Jacqueline, do you have any updates? I know you got a lot going on.
I think, just in general, we're in the process of winding down our rental assistance and utility assistance COVID programs. The cities, towns, and nonprofits that we work with have really, their staff have been absolutely phenomenal in making sure that we could, as a system, push out these funds to those who are most in need. So, that, and as I mentioned before, we have funded quite a few nonprofits. We had like nearly $8 million in requests, and we were able to fund just under 5 million, and then 3 million towards food banks and pantries. So in spite of everything else, it's nice to be able to get money to clients and to other organizations doing the good work.
What about your Kresge stuff? Have you been able to do anything with that, or is that on the back burner?
No, we have made significant progress on that. More behind the scenes, we have a case management and data system that will be rolling out in 2 parts. That was, funded partially through Kresge. So in the next month, and then in February, which will link all of our programs together, and making significant strides in creating, working with national organizations and creating trainings for staff and for other partners on class, social and racial equity and inclusion. So I'm excited to get that get that rolled out after the first of the year as well.
Great. Naomi.
So let's see. In August, we were awarded a grant from the Cities for Financial Empowerment Fund. And that grant was to assist those families that were being impacted by the pandemic by helping us develop and implement a financial navigator program and services. So our residents reach out to us, and then we are able to assess their needs and then refer them and get them into resources and other referrals for their specific needs. So that was a hard launch in October, and that's going well. So we're really excited to be able to offer that during this time. And then that goes up to July 21. And then after that, then we will see we'll work on how we can sustain that and continue that program. So
That's awesome. It's a financial navigator?
Yes, financial navigator, yes.
And it was cities?
It was the Cities for Financial Empowerment Fund. And actually the Tempe was the first in the state of Arizona to receive those funds.
Congratulations.
Excited to have done that and develop it. And so we'll definitely pass on the information to you all.
Oh, yeah.
So we really enjoyed, they're a great organization and they were wonderful to work with. Just great support getting us to where we need to go. So yeah, thank you.
Awesome. Good work. You guys are so awesome. Mary Lynn.
Okay, we just continue to do the same work. The Gila Bend Senior Center and New River Senior Center have reopened.
Wow.
They're in small communities, so I think they feel safer being open. The other senior centers continue to be closed. I'm pleased to let you know that most of the adult daycare centers have opened at 50% capacity. Foundation for Senior Adult Living tried to open all three, the Glendale, the Phoenix, and the Tempe one, but they had less than 25% at each. So they've consolidated them all into just the Phoenix one, and they're attempting to transport people into Phoenix so that there's some adult daycare, but that was a huge loss. They were closed from April 1st to the 1st of September. So caregivers, didn't have any place to send their loved ones.
Yeah.
So we're pleased that they are open. We are trying to get more home care providers. There are still some clients whose families don't want any strangers in their house, but they're starting to kind of let people in to help with that. So, so anyway, and everything else just keeps continuing, and we're trying to work through all of the challenges.
You keep so many plates spinning. I don't know how you do it.
Yeah, and the call volume keeps staying high. By the end of from March 17th until the end of July, we had another 20,000 additional calls. So we ended the year with trying to look and see something like 60,000 calls from seniors, looking for services. So it was, like I said, 20,000 up from the prior year.
Well, thank you for all that you do. Edith, what's going on in Avondale?
I do want to take this time to just give a big, huge compliment to our community action program and our staff in our family services division over at our resource center, who have managed to spend over $2.5 million within the last, from I think July, and we're pretty much out of funds after this week, and just having them ramp up and get everything going and get the funds out. Super proud of all of our staff out there. And then also our senior center, even though we're closed, our staff there has been very diligent about getting out the meals and providing the congregates in the afternoon and really staying engaged with our senior participants, especially because they do have a lot of difficulty trying to get on Zoom or the online platforms are not as easy. I wish we would have taught them some of that stuff before this pandemic hit. But in any case, just, we have a lot of city employees out there just doing above and beyond through this pandemic to keep our community safe and healthy and keep going and keeping them engaged. And so I just want to share that with this group, because I know that all of our communities out there are working just as hard and have had to shift a lot of things, get those services out there in a safe and healthy manner. And then the last thing is we are almost getting ready to move into our new building for the new resource center. So we're scheduled to move in December 18th. So please keep your fingers crossed for us.
Cool, that's exciting. And yeah, thank you, and thank your staff for all the work you do for our Goodyear residents. I have so much, I can't even imagine. It's like drinking through a fire hose. So thank you. Jason, what's the United Way been up to?
A lot. We're just plugging along on a lot of fun projects. We, first and foremost, we're just honored to be able to work with so many amazing partners that we have the opportunity to provide grants to in the nonprofit space and the education space, and not just through our normal grant process, but also through the COVID fund that we were able to be able to help with. All of that, we're just trying to, help those organizations continue to do the great work that they're doing during these unprecedented and hard times. With that, we are also developing our new strategic plan. We wrapped up a 10-year plan in 2020, and so it's time for a new plan. The original plan was to get that going in March, but then something happened, and so we had to put the pause button on that. But now we're back at it, and the idea is to have a 5-year plan that will really help to frame really the rebuilding efforts for our community in the post-COVID environment. So we're doing a lot of community input sessions. We've already done 14 of them so far, and we'll have a lot more to do through the end of this calendar year and going into hopefully wrapping up in late January, early February, which will then help us guide where future grant funding is going to go. And we are also using that to help remind donors and the community about some of the ongoing needs that are out there, so we can continue to provide some help out there. So we're just honored to be able to be in a space to help so many different organizations from the basic needs side as well as the education side. Just honored to also work with all of you, because you got everyone that's on this call and beyond has just been an amazing partner and collaborator. So just honored to work with all of you during this time.
That's awesome. Thank you so much. What do you think is the feasibility of working backwards ever in terms of funding? I mean, there was a lot of stuff that had to happen for COVID. Do you think funders might be amenable to retroactively, like?
A lot of the COVID dollars that we were able to support, and again, because those are private dollars, a lot of it was able to do some of that backwards kind of funding. But then we were limited by the amount of money that we had, and we only had about $3 million to get out. That's, we had a lot of quote unquote capacity building grants that were really just there to help, just those organizations stay afloat, quite frankly, and just to maintain services and to do some of the stuff we talked about here, which is making those adjustments just so they can transition to this new working environment, which was great. And we're so happy that they were able to do that. I'm not sure about, what future funding looks like in that kind of space. And I know that things such as like CARES Act dollars are great, but there's also a lot of, there's just more regulations and requirements than private funding.
Yeah.
And so we're very fortunate to, kind of backfill in some of those opportunities. And we continue to fundraise in that kind of space to help fill in the gaps of funding that some government dollars cannot. So,
That's awesome. Thanks.
you're welcome.
Debbie, what's going on in Peoria?
Oh, well, the Resource Center is back open. I've got 9 out of 16 agencies back in, and I have to echo what Eve was saying. The CAP crew here through Foundation for Senior Living has doubled in size right now. They are like the little beehive that's in here right now, doing all the hard work. They're working really hard. As a matter of fact, I asked one of them to do a Spanish translation and I got in trouble. They want every second to be helping the clients get the money to them. And we're still doing everything remotely. I still have full contact with all the agencies. I try to keep that line of communication really open because of the disconnect right now. We're doing a lot of events throughout the neighborhoods, doing all the proper social distancing. We've got this new pop-up van that's to do pop-up parties and pop-up events. So that's been kind of the driving force of, hey, what's that bright colored, fun looking van with the music playing out of it? Along with any events we do, we've got a boatload of flu vaccines. So the fire department is showing up at all the events also to give free flu shots. Just so you guys know, those ones coming through the county, Maricopa County, they do have, which I didn't even know to ask this, but one of the agencies asked me, they have the high dose for seniors, the regular flu shot, and then they also have the shot for the 4 years old and under. So that's just something to keep under your hat because I didn't actually know there was different kinds of shots to start with. So it was a little education for me. Let's see, what else? Right now, we're still adhering to like our conference rooms, even the large ones can only have like 10 people, that type of thing. And we're calling it phase 2 at our city. We have phase 1, 2, and 3. It's looking right now though that we're going to be in phase 2 for a long time until the numbers change. But you know what? The really amazing thing that's happening is I think we were pushed to learn how to do our virtual events better or at all. They were always kind of sitting out there, and the really daring people, which is not me, would test them out. But now what we're seeing happening is our free monthly seminars through our Peoria Support Awareness Series. The numbers are outrageous. I mean, we're having, we had a veterans event that maybe during the live session, there was 73 people attending, but within a couple of days, 315 people had already spent X amount of time reviewing it. And so that has been fantastic between our program and then my coworker, Jamie, she runs these HOA seminars, same thing. It's like, normally we'd have 50, 60 at the table for an event. Hers are like 800 views. I mean, it's incredible. I think for our demographic, I think it's something that needs to stay in place because we have a lot of seniors or a lot of disabled that can't get out whether there's a COVID or not, but would still want to learn things, So I just think it's that force made it better for everybody as far as how we're going to move forward with things. But, like everybody else, it's been interesting. We've got, like, I've gone back to 1 day working at home, just I think because the numbers went up a little, and that's okay though, because that works out because I get all my paperwork done then with no interruptions. So, but we're plugging along here.
That's awesome. Good work. Congratulations. And I hope everyone stays healthy and safe. And last but not least, Leah Chandler.
Yeah, so our CARES team that we hired is doing a ton of work. They're working directly with the court calendars on cases that are pending eviction to try to get in there and make sure that the people pending eviction know about the CAP office and how to access those resources. They're also doing the outreach directly to landlords, same thing. They've gone to visit apartment complexes and just reached out, do landlord outreach in a number of different ways to make sure the landlords know that they can direct their tenants to the CAP office. In addition, we've started a landlord incentive program to try to recruit new landlords for our Section 8 program. So we were able to use some CARES funding for that. And our application process is out right now for both our CDBG home and actually also our CDBG home and general fund dollars that closes right before Thanksgiving. And part of what we've asked from the nonprofits who are applying for funding is to kind of tell us what their continuing COVID needs are, with the hopes that we're going to be able to tap into some of our additional AZ CARES money that we have here in reserve to help the nonprofits. One interesting thing, though, that we've learned through this is our economic development department used some AZ CARES money to put out a program for the businesses, but nonprofits were not eligible for that funding. So what we're finding is there's a group of nonprofits out there that are not ones who typically apply for city human services dollars, but are now coming to the table because they can't tap into the business money. So they're kind of, in a category by themselves. So I think that two things are going to happen. We're going to see an increased number of applications because new nonprofits are coming. And I also think there will be a category of nonprofits whose programs may not necessarily meet our human services funding criteria, but there's still going to be a need there. So we're hoping that there's something we'll be able to do along those lines, and specifically for like PPE and things like that, that we'll be able to do along those lines come the first of the year or so if we're able to tap into some of our AZ CARES reserves.
So nonprofits were not eligible for the PPP program?
Not the one that went out through the Chamber of Commerce and our economic development. Any of the nonprofits that we were funding already through the human services funding, they all received additional dollars. Anybody who wanted it received additional dollars for PPE through the same process that we funded. We just tacked it onto their contracts really with the ones that are already currently being funded with human services funding. But if there's others out there that were not part of that process, they seem to be slipping through the cracks because they don't qualify for the program that economic development did, and they haven't been getting funding from my department.
I see. And what's the incentive you're doing for landlords?
We are doing $400 for every new unit that signed up.
Thanks. Gosh, you guys do such great work. I feel lame. Goodyear's plodding along, but we are starting our 5-year consolidated plan any day now because we are almost done with the procurement process for our consultant, who I'm super stoked to work with because I think that we're going to do some really innovative things in our citizen participation plan. So I'm excited to see what happens and so anxious to be able to have something official to work from in terms of being able to be responsive to our residents' needs. But in the meantime, thank you so much to Avondale and Maricopa County and all the rest of you who have helped to pick up the slack. I really appreciate you. And I keep thinking, have this story in my head every time I get a phone call or an email and I see another one just came in now from our utility customer service people, when they're hearing that the resident hasn't heard back from or couldn't leave a message because the voicemail box was full. And I just think, cannot even imagine being in this really crappy situation, possibly for the first time in my life, and having this ray of hope that someone told me I can call this phone number and I can't even leave a message. I mean, I just can't. I think I'd be in a heap on the floor somewhere. So I can imagine that when people finally are able to connect with the limited staff that exists to be able to get this huge volume of money out so quickly that people are grateful and possibly not the nicest even at the same time. So I am so grateful for the work that everyone's doing. Are there any comments from the committee? Any requests for future agenda items? Okay, well, Brandy, you have what you need from us?
Yes, I do. And we no longer need to ask for a motion to adjourn.
Cool.
So that was clarified. So that's my gift to
Nice.
you.
Thanks. Well, this meeting then is adjourned. Everyone have a great rest of the week and a very happy, safe Thanksgiving.
Happy Thanksgiving. Bye-bye.
Thanks for all that you do, everybody.
Bye.